Good morning, everyone, and welcome to the House Committee on Health, Human Services, and Elderly Affairs. As noticed, we have a number of bills to be considered in executive session this morning. But before we get to those, I'd like to ask you to please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. I'll say at the outset, and I know I've said it probably before, and I'll probably say it again before we conclude today, but today is the deadline, so all committee reports do have to be in today, ideally by early this afternoon. Obviously, they can't be, I know some of them may have already been prepared, but for those who will be speaking. But anyway, with that, we will start and start at the top. HB 1070-FN, and I believe Representative Drew, you wanted to offer a motion on that.
Thank you, Mr. Chair. I'd like to move in expedient to legislate for HB 1070.
Second.
And Representative Mazur seconds. Representative Drew, do you want to speak to your motion?
Just very briefly, I don't believe that this bill is necessary. It creates a situation where an EMS crew could call the police to handle a patient who's having a mental illness episode that's violent, and then the police could turn around and make them transport the patient involuntarily to the hospital. I don't think that's a viable situation, so I don't think we should pass this bill. Thank you.
Okay, any flurry of papers here? Any other discussion on this motion? Okay, well, that was quick, huh? All right, a motion is ITL on HB 1070-FN. I'm seeing no other discussion, so I'll ask the clerk to please call the roll.
Representative Mazur.
Yes.
Representative Reinford.
Yes.
Representative DeLamus, yes. Representative Kofal.
Yes.
Representative Palazzo.
Yes.
Representative Drew.
Yes.
Representative Popovich.
Papavici Mola.
Yes.
Thank you. I'm sorry. Representative McGrath.
Yes.
Representative Kesselring.
Yes.
Representative Lamonte.
Yes.
Representative Lane.
Yes.
Representative Nagel.
Yes.
Representative Woods.
Yes.
Representative Palmer.
Yes.
Representative Tejas.
Yes.
Representative Hartnett.
Yes.
Representative Lucas.
Yes.
And Representative McDonough.
Yes.
Okay, that is 18-0, and the motion passes.
Okay. Is there any objection to consent?
Nope.
Okay, thank you.
So,
And Nick? Yes, Representative Drew, you'll be doing the, you report on that. Okay, thank you. HB 1071 is next, and Representative Kesselring, I believe you have a motion.
Yes, I have an amendment, which is amendment 1006H.
Okay, and you were moving on to
I
pass on
move.
that amendment?
Yes, I do.
And I will second that. Representative Kesselring, do you wish to speak to your motion?
Yes, so this language cleans up the problem that was talked about in the committee, where it would allow for to go back in time. We're basically ending it as of the date of passage for the immunity.
All right, so the repeal of immunity would only be moving forward, not retroactive.
Correct.
Okay. Okay, any other discussion on the amendment? Seeing none, with that, I'll ask the clerk to call the roll. The motion is ought to pass on amendment. I'm sorry, Representative Lamonte. Oh, sure. Oh, sure, okay, sorry. Has everyone had a chance to read the amendment? Are there any questions or discussion? Okay, seeing none, I'll ask the clerk to call a roll. Motion is ought to pass on amendment 10068.
Representative Mazur,
Yes.
Representative Reinhardt,
Yes.
Representative Delamus, yes. Representative Copal,
Yes.
Representative Palazzo,
Yes.
Representative Drew,
Yes.
Representative Popovich.
Yes.
Popovich.
Papavici Muller.
Popovich. I
Papavici.
checked with him. It's, I checked with the.
Popovich Mueller.
Okay. Popovich Mueller. It doesn't, you don't make the I noise. No
All
pronunciation.
right.
you the wrong name for 3 years. Popovich Mueller. Yes? And Representative McGrath,
Yes.
Representative Kesselring,
Yes.
Representative Lamonte,
Yes.
Representative Lane,
Yes.
Representative Nagel.
Yeah.
Representative Woods,
Yes.
Representative Palmer,
Yes.
Representative Tejas.
Yes.
Representative Hartnett, Representative Lucas,
Yes.
and Representative McDonald.
Yes.
Okay, that's another 18 to 0.
Okay, Representative Kesselring, do you have another motion?
Yes, I move, ought to pass as amended.
And I will second that. And do you wish to speak to your motion further or for this issue further?
I think we're good. I think I've answered it. I mean, pretty cut and dry.
Thank you. Representative Woods.
Yeah, could you clarify again, I only had one ear tuned in when you were, chatting, just clarify for us exactly, what this accomplishes.
The amendment or the
Yeah, the amendment, cause
Okay.
it's a replace all, so.
Yes, so basically what we, in the hearing, we heard that based on the wording of the language, we were concerned, or there was concerns, that, that the language would make it so that it was basically go back, it would be anything that happened during COVID and preemptively, people could go after them for the immunity issue, so there was a legal issue, there was a lot of different concerns. So based on that, we made it so that immunity would go as of the date of passage, so it would be removed from then instead of retroactively going back in time.
Any other questions?
Thank you.
Okay, seeing no other questions, motion is ought to pass as amended on HB 1071. Madam Clerk.
Representative Mazur,
Yes.
Representative Reinhardt,
Yes.
Representative Delamus, yes. Representative Copal,
Yes.
Representative Palazzo,
Yes.
Representative Drew,
Yes.
Representative Popovich Mueller,
Yes.
Representative McGrath,
Yes.
Representative Kesselring,
Yes.
Representative Lamonte,
No.
Representative Lane,
No.
Representative Nagel. No. Representative Woods,
No,
Representative Palmer,
No.
Representative Tejas,
No.
Representative Hartnett, and Representative Lucas,
No.
Representative McDonald.
Yes.
That would be 10 to 8. And the motion passes.
Okay. I'm assuming there'll be a minority report.
this is with the amendment.
Representative Lamontagne, do you know who might write that or?
No,
I believe Rep Wood is going to read.
Representative Wood, you'll be doing the minority report? Okay, thank you.
And the motion on that is gonna be, ITL?
Yes.
Okay, next up is HB 1117 FN and Representative McGrath. I believe you have a motion.
Yes, I'd like to move amendment 10268.
I have that one. Does everyone have one? Oh, I have it. Okay, I'm all set. Yeah, thank you. And Representative Kesselring, I believe you're seconding?
Yes, I second.
Okay, would you like to speak to your motion, Representative McGrath?
Yes, so there was a couple additions. Instead of provider, it says healthcare provider. Instead of medications, it says FDA approved medications. And then the enforcement and remedies clarifies section 1, and in section 2, talks about the remedies that are already protect healthcare providers, in the federally.
Okay, thank you. Any other discussion on this particular motion? Seeing none, I'll ask the clerk to call the roll. Motion is ought to pass on amendment 1026H to House Bill 1117 FN. Madam Clerk.
Representative Mazer,
Yes.
Representative Reinfurt,
Yes.
Representative Delamus, yes. Representative Kofal.
Yes.
Representative Palazzo.
Yes.
Representative Drew.
Yes.
Representative Popovich.
Yes.
Representative McGrath.
Yes.
Representative Kesselring.
Yes.
Representative Lamonte.
Yes.
Representative Lane.
Yes.
Representative Nagel. Representative Woods. Representative Palmer.
Yes.
Representative Tejas.
Yes.
Representative Hartnett.
Yes.
Representative Lucas.
Yes.
And Representative McDonald.
Yes.
Great. 18-0, motion passes.
Okay, Representative McGrath, do you have another motion?
Yes, I'd like to move, HB 1117 ought to pass as amended.
Okay, thank you. And Representative Kesselring?
I second.
Thank you. Do you have anything further to add, Representative McGrath, or?
Just that it's medical free speech. I hope everybody supports it.
Thank you. Any discussion? Representative Nagel?
I really do appreciate this effort, as we talked about during the hearing. What I'm struggling to understand is what this accomplishes that we don't already have. We looked at statute, we looked at rules, we looked at the medical AMA Code of Ethics books, and virtually everything in here is already exists. The problem is, like with a lot of things, just as an example, I've been working with the ADA now since it was passed, and it's a great piece of work. It's wonderful in paper, and when the rubber meets the road, it falls apart all the time, for a lot of reasons. And I kind of see this as the same way. It's a feel-good thing. Everything in here already exists, and that's why I'm struggling with passing it. I just think that it doesn't really add much to what we already have.
Any other discussion? Representative Kesselring?
Thank you, Mr. Chair. So I want to add not so much to that, but I want to give some clarity. So looking at the amendment with Representative McGrath, I found that a lot of this is not codified or clarified in statute. So this is actually a good cleanup to make sure that all the things that we did here that are in laws or in different programs or in different boards is now the state is saying this is kind of laying it out. So it does clean it up a lot.
Anyone else? Seeing no one else, I will ask the clerk to call the roll. The motion is ought to pass as amended on HB 1117-FN. Madam Clerk.
Representative Mazer,
Yes.
Representative Reinfurt,
Yes.
Representative Delamus, yes. Representative Kofal,
Yes.
Representative Palazzo,
Yes.
Representative Drew,
Yes.
Representative Popovich,
Yes.
Representative McGrath,
Yes.
Representative Kesselring,
Yes.
Representative Lamonte,
No.
Representative Lane,
No.
Representative Nagel, Representative Woods,
No.
Representative Palmer,
No.
Representative Tejas,
No.
Representative Hartnett, Representative Lucas,
No.
and Representative McDonald.
Yes.
Okay, that would be 10-8,
Okay.
and that,
And I assume there'll be a minority report on that? Do we know who's writing that? Representative Woods? Okay, thank you.
thank you.
Okay, next up is HB 1249. Representative Kesselring, I believe you have a motion?
Yes, I move ought to pass.
And Representative Mazer, I believe.
second.
Representative Mazer seconds. And Representative Kesselring, do you wish to speak to your motion?
Yes, I do. So this bill, as currently written, basically does one very important thing, in my opinion, is to make it so that an item like a nebulizer can be purchased at a pharmacy, and you won't have to wait days to find or get it from the doctor or borrow one from the hospital.
Okay, thank you. Any other discussion on this motion? Seeing none, I'll ask the clerk to call the roll then. The motion is ought to pass on HB 1249.
Representative Mazer,
Yes.
Representative Reinfort,
Yes.
Representative Delamus, yes. Representative Copal,
Yes.
Representative Polozov,
Yes.
Representative Drew,
Yes.
Representative Popovich.
Yes.
By the time we're done, you'll be good at this.
I don't know if I will.
BPM?
Representative McGrath,
Yes.
Representative Kesselring,
Yes.
Representative Lamontagne,
Yes.
Representative Lane,
Yes.
Representative Nagel,
Yes.
Representative Woods,
Yes.
Representative Palmer,
Yes.
Representative Tejas,
Yes.
Representative Hartnett, Representative Lucas.
Yes.
And Representative McDonald.
Yes.
Okay, that is 18-0 and the motion passes.
Is there any objection to consent? Okay, seeing none. Okay, moving on to HB 1335. Representative McGrath, I believe you have a motion?
I move HB 1335 ought to pass.
Yes. And I will second your motion, Representative McGrath. Do you wish to speak to that motion?
No, I think we're good.
Okay. Any discussion or questions or thoughts? Representative Nagel?
Thank you, Mr. Chair. Thanks for, never mind, you know what I mean. I thought a lot about this bill and I spoke a lot about it during the hearing and I really appreciate the intent. But I really think this is something that needs to be studied. I was gonna make an amendment about it, but I realized that there was a lot of different moving pieces on this. I'm gonna give you one example. Tomorrow morning, I'm flying to Salt Lake City to speak at a meeting that I will be paid in back for. I get nothing personal out of that other than influencing young minds in a positive or negative way. A couple of years ago when I did this, the total cost of that trip would have been about $2,500. Now it's gonna approach 5,000. I think that number is way too low. I think it needs to be higher. I also think that virtually everything in here regarding physicians is already covered in the same things that I mentioned earlier. And thirdly, in my practice and my experience, the group of people that I'm really concerned about are non-physician providers. And I used an example of stem cell therapy during the hearing. For example, it's mostly chiropractors, but most stem cell therapy right now in the United States is crap. Excuse my French for saying that word, but it is. It's not evidence-based, it's not real stem cells, and so on and so forth. They charge patients a lot of money and get kickbacks for doing it that are greatly more than $5,000. I think they need to be included in this legislation. There was a magnet scam that used to go around primarily among physical therapists where they would provide magnets on a pyramid scale, and they got substantial kickbacks for doing that. Acupuncturists get paid to do herbal medicine. They get about half the reimbursement back from doing it. I think they need to be included in this also. So my suggestion is that we interim study this, sit down, spend a lot of time, figure out who needs to be involved with this legislation, look at that number 5,000, figure out what a number should be, perhaps see what other states are doing, and then come up with legislation that I think is more thorough and comprehensive, which I think the same thing.
Thank you. Any other discussion? Representative Woods?
Again, just to emphasize that as far as the physician part is concerned, it's covered by the AMA Code of Ethics, and that's ensconced in our current New Hampshire law. So in that sense, it's covered, but I just emphasized, as Dr. Nagel indicated, this should cover everybody, not just physicians.
Thank you. Anyone else? Seeing no one else? Okay, the motion is out to pass on HB 1335. Madam Clerk, please call the roll.
Representative Mazer,
Yes.
Representative Reinfort,
Yes.
Representative Delamus, yes. Representative Copal,
Yes.
Representative Polozov,
Yes.
Representative Drew,
Yes.
Representative Popovich,
Yes.
Representative McGrath,
Yes.
Representative Kesselring,
Yes.
Representative Lamontagne,
No.
Representative Lane,
No.
Representative Nagel,
No.
Representative Woods,
No.
Representative Palmer,
No.
Representative Tejas,
No.
Representative Hartnett. Okay. Representative Lucas,
No.
And Representative McDonald.
Yes.
Okay, that's 10-8. Motion passes.
Okay, and who is doing the minority report? Well, you're gonna be a busy guy. And that'll be ITL, I assume? Okay.
Thank you.
Hope we don't get Writers Cramp, Representative Woods.
Can I ask,
You have a question, Representative Nagel? Is it
I
drained?
don't know if I'm asking a question for the group or for us, or the caucus.
If it's a caucus issue, you should caucus.
Yeah, you're right, cause never mind.
Okay,
Study or ITL, that's my question. We'll talk about it. Never mind, we'll sleep with it.
okay, next up is HB 1337 and Representative Kofalt. I believe you have a motion,
Yes, I move ought to pass.
and I will second that motion. Representative Kofalt, do you wish to speak to your motion?
Yes, thank you, Mr. Chairman. So we have heard a number of concerns about the Autism Council, in particular parents, families in the community have indicated the Autism Council has been ineffective in representing them in fulfilling the duties that they were charged with. We've also heard some concerns about the council sort of giving itself powers that are not specified in statute, such as the power to appoint members and sort of establish a quorum that takes vacancies into account. So I think this is a council that has not served its purposes and should be repealed.
Thank you. Representative Woods.
Thank you. Our initial exposure to this council was as described just now. However, received a lot of material. I think hopefully everybody got that same material and showed that this council indeed has been very active. And in fact, there is a 2025 annual report online, and they sent that around. They understand there are some deficiencies, and last year I proposed a bill, HB 634, to address the deficiencies in the commission. That bill did not go forward, but they are still keeping those identified deficiencies in mind, as evidenced in multiple minutes, which were, I think, provided to everybody. So they have been active. They are aware that they have deficiencies. They have an annual report for everybody's perusal. They last year through HB 140, which was a blue envelope program, which is an envelope that people can carry with them in their car, identifying that they have deficiencies and what they are, and mechanisms to convey that to anybody who, police or whoever needs to interact with them. And that was signed by Governor Ayotte July 13th of 25. So I think if we look, a lot of commissions did have difficulty over the COVID time and took some time to recover. And I'm actually sort of co-chairing the Commission for the Deaf and Hard of Hearing, going through exactly the same process. So I think what we encourage people that have special needs to be direct participants. And I think dropping this commission would send the wrong message. They are trying. It may not have been 100% to meet the highest of all standards, but they're definitely trying, as we can see by virtue of what Governor Ayotte signed into effect last July. Their 2025 annual report, which outlines, and reading some of their notes as well. So I appreciate that, in fact, that we should be aware when things are falling apart, and there's no sense of any possible recovery to, in fact, proceed do as anticipated. But that, I don't think that's the case, and I strongly recommend that we ITL this and let this committee continue what it's obviously, by virtue of what I've just described, I think doing an admirable job in face of the deficiencies and the problems that they face. So, thank you.
Thank you. Anyone else? Representative Nagel.
Thank you, Mr. Chair. I fully understand the problems. I've seen a number of committees, but I think what I did get out of the hearing was that everybody there, whether they like this committee or not, have said that there needs to be something, that the Disability Council is not enough, that this is really important. One person thought we needed to start all over. What I've found in some of the similar committees that I've worked on is that sometimes just asking one question reinvigorates the entire effort. And it seems to me that that is what's happening. And I do think that they should be given time, maybe sunsetted time or reviewed time period, to see where they get with that and have all these people get involved and see where they can go with the current structure. Because I think, in a sense, throwing it out, throwing the baby out with the bathwater, and you're going to end up having to start all over with something. And I think you're in a good place now. And let's see if we can get in a better place in a year or two. So I would also agree with ITLing this.
Representative Polazzo.
Thank you, Mr. Chair. There is a lot of confusion discovered with scope of work for this council and also with expenses. Many people on this council really want to provide services for this community. Unfortunately, the scope of work is more providing consultations to other organizations. So it's kind of, there was some confusion, and it looks like even if we repeal it, the same services would be delivered because the council was not authorized to provide services. And the same similar confusion around expenses. We had during testimony some concerns, and reviewing details for me did confirm that some expenses seemed not quite appropriate to the mission and kind of too generous. So I will be voting yes. Thank you.
Thank you. Anyone else? Seeing no one else? Okay, I'll ask the clerk to call the roll. The motion is ought to pass on HB 1337.
Representative Mazer,
Yes.
Representative Reinfurt.
Yes.
Representative Delamus, yes. Representative Copal.
Yes.
Representative Polazzo.
Yes.
Representative Drew.
Yes.
Representative Popovich.
Yes.
Representative McGrath.
Yes.
Representative Kesselring.
Yes.
Representative Lamontagne.
No.
Representative Lane.
No.
Representative Nagel.
No.
Representative Woods.
No.
Whoops, hold on. Representative Palmer.
No.
Representative Tejas.
No.
Representative Hartnett. Representative Lucas.
No.
And Representative McDonald.
Yes.
Okay. And that is 10-8. And the motion passes.
Okay, and who will be doing the minority? Representative Woods.
Oh, my goodness.
Okay.
God bless you.
Okay, next up is HB 1449. Representative McGrath, I believe you have a motion.
I have an amendment, 0989H.
Okay, you're moving on to pass on that amendment.
Oh,
Representative,
OTP, I'm sorry.
Representative McGrath and Representative Drew.
Second.
Representative Drew seconds. Would you like to speak to your motion?
Yes, it was just changing the word in section 3 from effect the duties of school nurses to affect the duties. So it's just a clerical error.
Okay, you said that was 09898?
Yes.
Okay, great. Thank you. Any other discussion on the amendment? Seeing none, if the clerk is ready, I'll ask her to call the roll. The motion is ought to pass on amendment 0989H.
Representative Mazer,
Yes.
Representative Reinfort,
Yes.
Representative Delamus, yes, Representative Kofal,
Yes.
Representative Polozov,
Yes.
Representative Drew,
Yes.
Representative Popovich,
Yes.
Representative McGrath,
Yes.
Representative Kesselring,
Yes.
Representative Lamontagne,
Yes.
Representative Lane,
Yes.
Representative Nagel, Representative Woods,
Yeah.
Representative Palmer,
Yes.
Representative Tejas, Representative Hartnett, Representative Lucas,
Yes.
and Representative McDonald.
Yes.
I didn't say anything. No. I was a little confused. So, no.
No, okay. Sorry
Oh,
about
so that was the
that.
amendment, right? I'm confused, yeah. Not enough caffeine. Make that a yes.
Make that a yes or?
Yes, I'm sorry.
Oh,
Yeah.
okay,
Yeah.
So that's 18-0, right?
yes, 18-0 on the amendment.
Okay, Representative McGrath, do you have another motion?
Yes, I move HB 1449 as amended ought to pass with amendment.
Okay, thank you. And Representative
Second.
Drew, Representative Drew seconds. Any other discussion on the bill?
So when I gave my testimony, I was going to take out the part about the school hours and just have it be parents being present at school vaccine clinics. But after speaking to a lot of parents, I'm leaving it with both pieces. It basically does the same thing, protect every single child from being accidentally vaccinated, even though they may have had a medical exemption.
Thank you. Representative Lucas, you had your hand raised?
Thank you, Mr. Chair. I will be voting against the ought to pass as amended for a number of reasons. There are many folks in rural areas who would have to drive a great distance from work to school to be present with their children that they've already specifically given written consent for immunizations. Or they may have unreliable transportation and have to make arrangements for that. Or they may have children that are younger than school age that they would need to make arrangements for childcare. And I think that these are all reasons for the initiation of school vaccination programs to begin with. And we did hear that 2 New Hampshire school children out of thousands were vaccinated against parental consent. And I would propose that this is more of a best practice issue. And I don't think it's a good enough reason to deprive thousands of school children the opportunity to be vaccinated as their parents and legal guardians desire. Thank you, Mr. Chair.
Thank you. Representative Delamus.
Thank you, Mr. Chair. I'm in agreement with Representative McGrath, and for me, one mistake is one mistake too many. When something like that happens, I know if it were my child, I would be absolutely livid. And how do you take that back? And what if there's injury from it? What if there's an allergy? I have allergies that I don't even know about, and I sometimes end up on the floor of a bathroom because I've eaten something wrong. So the seriousness of getting a vaccine, I think, should be taken by all, and definitely this is needed to protect those kids.
Thank you. Representative Lamontagne.
Yeah, I'm going to be voting against the ought to pass. I certainly remember my days as a working mother and also living on a farm in a rural area. It was a half an hour to the doctor's office. This is an option that we should not be denying the many, many parents who see this as a convenience. And the schools can opt in to participate in the school vaccine clinics. And parents can opt out, but we shouldn't deny parents their right to participate in this and have their children vaccinated at a school clinic. And also the argument that we're taking too much time out of the classroom if there's a flu outbreak, you're gonna have kids missing a whole week of school.
Any other discussion? Representative Palmer.
So, thank you, Mr. Chair. I'll start just by saying, I think I've made mistakes over 40 years, so should I have been banned from practicing medicine? I think this is a parent and rights and a local control issue, and we shouldn't be passing this.
Representative Nagel, did you have your hand up?
Yeah, Dr. Palmer just eloquently said what I was gonna say in a much.
Other discussion? Seeing none?
Oh,
Oh, I'm sorry, Representative Tejas.
thanks, Mr. Chair. I want to reiterate that somebody mentioned this is a best practice issue. It's a quality assurance issue. You don't fix things by making things harder and more complicated. You fix things by, as in business processes, you try to interrogate what went wrong and fix what went wrong. And this is not the right solution for that.
Thank you. Anyone else? Okay. I'll ask the clerk to call the roll. The motion is ought to pass as amended on HB 1449.
Representative Mazer,
Yes.
Representative Reinfort,
Yes.
Representative Delamus, yes. Representative Kofal,
Yes.
Representative Filazzo,
Yes.
Representative Drew,
Yes.
Representative Popovich,
Yes.
Representative McGrath,
Yes.
Representative Kesselring,
Yes.
Representative Lamontagne,
No.
Representative Lane,
No.
Representative Nagel,
No.
Representative Woods,
No.
Representative Palmer,
No.
Representative Tejas,
No.
Representative Hartnett, Representative Lucas,
No.
and Representative McDonald.
Yes.
That is 10-8. Motion passes.
And who will be doing the minority report? Not, Representative Lucas, okay. And that'll be ITL, I assume?
Yes, thank you.
I'm so used to looking over at Representative Woods, breaking my rhythm here.
We'll use a hand surgeon, he can deal with his carpal tunnel syndrome.
Okay, next up is HB 1706 FN, and Representative Drew, I believe you have a motion.
Thank you, Mr. Chair. I move OTP on HB 1706.
Representative Delamus?
Second,
Representative Delamus seconds. Do you wish to speak to your motion?
No.
You do not wish to speak, okay. Any other discussion on 1706? Representative Hartnett?
I wish I could vote for all of you in opposition to this bill. I find that it really trashes a great deal of American history and tarnishes our future. I found the prime sponsor's approach and discrimination patently offensive. I'll be voting no.
Thank you. Any, yes, Representative Palmer?
Yes, thank you, Mr. Chair. I just would note that online opposition was 1,402 to, in opposition, and support was only 354, and I'm going with that.
Other discussion? Representative Woods?
Thank you. I was somewhat dismayed by some of the testimony during committee, and even more greatly dismayed by some of the online submitted testimony that clearly did not understand the difference between refugee and immigrant and the purposes of each, and the people involved. Someone asked me about that, and I said, well, you do understand that Einstein was a refugee. Werner von Braun was a refugee, and he gave us our rocket program. I've had personal interaction with people in the refugee program. One was a physician, her brother, a physician. She interpreter for the prime minister at Kabul in Afghanistan. They blew her car up on the way to work one day as she was an interpreter. She had immaculate English. They called her that night. She was safe. They called her that night and said, oh, sorry, we missed it today. We'll get you tomorrow. She was able to get she and a number of her family out. And that's the kind of people, the Einsteins, the physicians, the people that have been on the line for us. And they came, she and her brother and other family members. I worked so that we could get them a job at Concord Hospital as patient advocates. They didn't have licenses, but they could be patient advocates. He finished his pediatric residency, missed 4 months, is now practicing in Texas. She met a charming young man and ended up moving to Switzerland, so we missed out on her. But I think there's a disconnect with people don't understand the difference between the two. And the numbers that the CBO, Congressional Budget Office, gives in terms of the money we spend for this program versus the money that is returned to the U.S. is substantially greater return than what we put into the program. So for all those reasons, both academic as well as my personal experience, I really have to vote against this.
Thank you. Representative Tejas, did you have your hand up?
Thank you, Mr. Chair. So, I'm going to address the technical issues of this flawed bill, which is based on not understanding how the refugee program works. A couple issues. One is the bill has language about prohibiting the use of state funds. There are no state funds used in the state refugee program whatsoever. It is all federal funding. Two, if this program in state government is closed, a new state refugee program will be created elsewhere. It does not have to reside within state government. And so part of what DHHS reminded us of is if we allow that to happen, because, the funds are for refugees who have already been resettled in New Hampshire. We will not, closing the state refugee program at DHHS has nothing to do with refugees being resettled in New Hampshire. The state refugee program currently at DHHS gets money from the feds that they pass through and put out to help support the refugees who are already here to become self-sufficient at the earliest date possible with employment programs and other kinds of programs that help ensure their success. By closing the office, and it will pop up elsewhere, we are now forfeiting a funding stream that will no longer be available. So that is shooting ourselves in the foot. And then we will also miss out on the current efficiencies. There are great efficiencies by the state refugee program residing at DHHS because there's other programs, and we will lose those efficiencies. So it just technically, it's not a very good bill.
Representative Nagel?
I feel like I'm adding more, but you know, I'm really honored in my office. We work with refugees on a daily basis, and our they're mostly the custodial group at night. They've, you know, it's really neat because I like working late and I see them often, and you know, you get to know them, and then you start to hear their stories because they're smiling and, you know, whatever, and they're happy to see me. I'm happy to see them, and then they start telling you stories about why they're here, and it just rips your heart apart. But the one that really bothered me the most was this gentleman, David, who came from the west coast of Africa, who was a refugee here, who was a professor there. They had an overthrow of the government, and unfortunately the intelligence of the people that frequently get suffer, and he basically had to flee the country, came here, and here he's working as a custodian. He was an older guy, he was in his 60s, and very smart, and I just love to talk to him. And we were talking about our hometowns, and I told him once how I miss mine, and he told me how he missed his, and he asked me, why don't you go back home? And I says, well, I'm here, blah, 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 blah. He says, why don't you go home? And he says, because they'll kill me the minute I get off the plane. And it's like, that's just really sad. I have another friend from Iran, same thing, political refugee, moved here because he wasn't a Muslim, he was a Baha'i. When the Shah was deposed, he had to come here, and he wanted to go home. He loved home, and he couldn't. The minute he gets there, they'll kill him. And those are the people that are coming here. They're creating a new America. These people work hard. And I think we should be proud to be here. Both of my grandparents were refugees, and I know they came here under a very different setting, but I really honor the sacrifice that they made to allow me to do what I do, Because without them and without this country allowing them to do that, I wouldn't be here, which may be good or bad for you, but that's another story. But thank you.
Thank you. Representative Polazov.
Thank you, Mr. Chair. I agree with Representative Woods that Einstein and many other refugees will and are a net benefit to our society. And it is probably true, even though Einstein, after being welcomed in America, acted as a committed socialist seeking to destroy our capitalist society. But still, and I also believe that it was also established during testimony that vetting process is long and thorough, even though it cannot discover every threat. But at the same time, Prime Sponsor provided us with many facts about burden to our society and our citizens from this program. And I believe that after review, all those facts are correct. So as an immigrant myself, I see a great benefit in us returning to merit-based immigration. So I will be voting in support of this bill.
Anyone else? Seeing no one else? Okay. Motion is ought to pass on 1706 FN. Madam Clerk.
Representative Mazer,
Yes.
Representative Reinfort,
Yes.
Representative Delamus, yes. Representative Kofalt,
Yes.
Representative Palazzo,
Yes.
Representative Drew,
Yes.
Representative Popovich,
Yes.
Representative McGrath,
Yes.
Representative Kesselring,
Yes.
Representative Lamontagne,
Nope.
Representative Lane,
No.
Representative Nagel,
No.
Representative Woods,
No.
Representative Palmer,
No.
Representative Tejas,
No.
Representative Hartnett,
No.
Representative Lucas,
No.
and Representative McDonald.
Yes.
Okay, that's 10-8, motion passes.
And who's doing the minority report on this one? Representative Tejas, okay, thank you. And that'll be ITL? Okay. Okay, next up is HB 1760 FNA, and Representative Mazer.
Yes, thank you, Mr. Chair. I move HB 1760 ITL.
And I will second that. Do you wish to speak to your motion?
Yes, and I'm just going to read it because I have a lot of paperwork here and I got to focus, so I'm reading it. Apologies. Repealing the co-payment and premium directives removes reasonable cost-sharing measures designed to promote personal responsibility and program sustainability within Medicaid and related programs. These provisions were enacted to help control long-term costs while preserving access to care. And by eliminating these requirements and providing an open-ended appropriation to cover the shortfall, this bill shifts additional financial burden onto taxpayers without identifying a stable funding source.
Okay, thank you. Any other discussion? Seeing no other discussion? Okay, the motion is inexpedient to, oh, I'm sorry, Representative Lucas. That's okay. 1760 FNA.
Thank you. I will be voting in favor of ought to pass on HB 1760 FNA.
Okay, you know the motion is ITL.
I'm sorry, I'll be voting against
Okay.
the motion to
Okay.
ITL.
Just to clarify, okay.
Yeah, thank you very much. And one of the reasons is that it will, I'll just backtrack a little bit and read. People on fixed incomes and with limited resources will not be able to afford the pharmacy co-payments as currently directed unless it is repealed, leading to unfilled or delayed prescriptions, worsening chronic health conditions and disabilities, and ultimately more expensive health care that will bring unintended costs to the state. We heard in testimony that other states that have implemented the program that currently exists in New Hampshire have seen coverage losses. In Oregon, for example, where enrollment dropped by nearly half for the qualified affected population, and those who disenrolled were 4 to 5 times more likely to go to emergency rooms for usual source of care than people who remained enrolled, creating more uncompensated care costs to be absorbed by providers and taxpayers. We also learned that under OB3, there's a federal cost sharing for Medicaid premiums due to begin on October 1st, 2028, that will supersede the current, in effect, 2025 HB2 state directive. And therefore, under this directive, the Department of Health and Human Services, which is already beleaguered by a $51 million budget cut, will need to find funding to implement software and administer this directive, only to have that system rendered obsolete 18 months later when the OBBB directives take effect. Healthcare providers will experience financial whiplash between the state directives and the implementation of the federal directives. HB 1760 restores stability to this process by repealing 2025 HB2 directive in anticipation of the federal government directives coming in 2028 and protects small business bottom lines from legislative flip-flopping. HB 1760 will also prevent the expansion of Medicaid premium charges to between 7,000 and 8,000 children. For those reasons, I will not support ITL.
Thank you, Representative Popovich Muller.
Thank you, Mr. Chair. I will be very brief and say that I have been on the school board in Windham, and at the time we had a healthcare plan for our teachers that was 100% paid. Every dime was paid by the city. Would you like to know how much higher the number of doctor visits were under that program because everything was free to the user? Having a reasonable co-payment and skin in the game for people who participate in programs is meant to be a way to make sure that they only use the resources when they really need to use the resources. This is a good program. It should stay in place, and I'm going to continue to support it. Thank you.
Representative Palmer?
Sorry, listening to my neighbor sort of drove out of my head what I was going to say. But but what it did, so thank you, Mr. Chair. First thing is, I mean, it's very different to ask somebody who's making $60,000 or $80,000 a year as a teacher to pay $5. It's another thing to ask somebody who doesn't have any money to begin with to pay a co-payment. The thing that I was going to say was that our ERs in the critical access hospitals I'm affiliated with are already overwhelmed, and we just can't start dealing with people's minor problems that could be dealt with in the clinic if they had insurance.
Thank you. Anyone else? Representative Tejas.
I just want to add that there's years and years and years of health services research evidence that skin in the game doesn't really impact utilization. It just makes things worse.
Other discussion? Seeing no other discussion, motion is inexpedient to legislate on HB 1760 FNA. Madam Clerk.
Representative Mazur,
Yes.
Representative Reinfort,
Yes.
Representative Delamus, yes. Representative Kopal.
Yes.
Representative Polozov,
Yes.
Representative Drew,
Yes.
Representative Popovich,
Yes.
Representative McGrath,
Yes.
Representative Kesselring,
Yes.
Representative Lamontagne,
No.
Representative Lane. No. Representative Nagel.
No.
Representative Woods.
No.
Representative Palmer.
No.
Representative Tejas.
No.
Representative Hartnett.
No.
Representative Lucas.
No.
And Representative McDonald.
Yes.
10-8, motion passes.
You're doing the minority report? Thank you, Representative Lucas.
Oh, good.
And that will be to pass?
Yes.
Great, thank you. Next up is HB 1772 FNA, and Representative Drew, I believe you have a motion?
Thank you, Mr. Chair. I'd like to move OTP on Amendment 2026 0365H.
0635H.
0365.
0365H.
And I would like to second your.
And Representative Polazov seconds. Representative Drew, do you wish to speak to your motion?
Thank you, Mr. Chair. Yes, this is the amendment that we talked about during the testimony. What it does is it takes all of the language about participating in a program and the other things that were part of the structure that was built, and it just eliminates those and simply says that ibogaine can be prescribed for investigational use in New Hampshire. So this removes all of the complexity of the previous bill and simply says doctors can prescribe ibogaine if they're doing a study or something like that. So.
Representative Hartnett.
Let me just start by saying, with ibogaine and other hallucinogens, I'm hopeful. These are medications, or they have a use that has some potential, but we really don't know what that potential is. The challenge I have with the bill, and believe that it needs to be studied, is the language of investigational use only. I've tried to sort out whether or not that's a term of art or has some special meaning in law or science, and it, best I can tell, it does not. So that literally means anyone can define what investigational use is. And I want to remind everyone, this is a Schedule I drug. This is a hallucinogen. This can drive psychosis, mania, cardiotoxicity, any number of health, behavioral health and healthcare concerns. I also would remind us, I think we passed unanimously out of this committee the creation of an advisory committee, House Bill 1980, and it would seem that might be interim study or a place for us to proceed with this. I find the language in this reckless may be dangerous.
Thank you. Other discussion? Representative Lucas.
Thank you, Mr. Chair. In doing some research on ibogaine, I learned that it's only been within the last year that a non-plant synthetic source of the drug has been developed. So that clinical studies that are approved and carefully monitored can easily be conducted, and none of those are yet underway. So I would like also to see this bill go to interim study, partially for the reason that we need to await more developments in the field before I think we can offer any type of legislation that has meaning and is safe. Thank you.
Thank you. Representative Nagel?
We're just talking about the amendment now, correct?
We are, just the amendment right now.
I'm sorry, I didn't speak to the amendment.
That's fine, that's fine. Any other discussion? Seeing no other discussion, I'll ask the clerk to call the roll. The motion is ought to pass on Amendment 0365H to HB 1772 FNA.
Representative Mazur,
Yes.
Representative Reinfurt,
Yes.
Representative DeLemus, yes. Representative Kopal.
Yes.
Representative Polazov.
Yes.
Representative Drew.
Yes.
Representative Popovich.
Yes.
Representative McGrath.
Yes.
Representative Kesselring.
Yes.
Representative Lamontagne.
No.
Representative Lane.
No.
Representative Nagel.
No.
Representative Woods.
No.
Representative Palmer.
No.
Representative Tejas. No. Representative Hartnett.
No.
Representative Lucas.
No.
And Representative McDonald.
Yes.
That's 10-8. Motion passes.
And Representative Drew, do you have another motion?
Thank you, Mr. Chair. I do. I'd like to move ought to pass as amended for HB 1772.
And Representative Polazov?
And I'm second.
Okay, any other discussion, Representative Drew? Or-
I think we've pretty much covered it.
Okay, thank you. Any other, Representative Nagel?
Just to give a little history here, New Hampshire was the 49th state to pass a prescription drug monitoring program. We were the 27th state to pass medicinal marijuana program. And I think those are really good things because we watched other states make mistakes. We learned from that. And I think, at least as far as the PDMP program was concerned, we made a really good one. I think our cannabis program has issues, and maybe it would have been better if we waited to be number 35 or 36 instead of 27. But still, it's substantially better than what other states did. If you look at the benefit risk ratios of opioids versus cannabis versus these drugs, they're not even on the same page. The risk benefit ratio of this particular type of medication that we're talking about is extremely toxic. It's Schedule 1 for a reason. I would be more than happy to let other states look at this, do this, study it, make their mistakes, and then come back to us later. I do have a lot of patients that self-medicate with these things, and it's not a good thing. And so I will not be supporting this.
Thank you. Anyone else? Representative Papavici Muller.
Thank you. I would just like to remind everyone what I'm sure you already know, that marijuana was also a Schedule 1 drug for a very unclear reason for decades. So we need to look at them individually, not just bring up the Schedule 1, because frankly, the feds made that designation meaningless.
Anyone else? Okay, motion is ought to pass as amended on HB 1772 FNA. Madam Clerk.
Representative Mazer,
Yes.
Representative Reinfurt,
Yes.
Representative DeLemus, yes. Representative Kofal.
Yes.
Representative Palazzo,
Yes.
Representative Drew.
Yes.
Representative Popovich,
Yes.
Representative McGrath.
Yes.
Was that was a yes? Okay, sorry. Representative Kesselring,
Yes.
Representative Lamontagne,
No.
Representative Lane. No. Representative Nagel. No. Representative Woods.
No.
Representative Palmer.
No.
Representative Tejas.
No.
Representative Hartnett.
No.
Representative Lucas.
No.
And Representative McDonald.
Yes.
Okay, that's 10-8. Motion passes.
And Representative Hartnett, you're doing the minority report?
Mr. Chairman, can I ask a question?
Sure.
It's a pragmatic question. Are we being recorded?
Yes. Yes, we are.
And is it the
And
public?
the motion will be ITL, Representative Hartnett?
No, interim study.
Interim study, okay. Is that your question, Representative Mason? Okay.
The public has access.
Oh, yes.
after the
Oh, yeah, absolutely. As with any hearing or any proceedings we do.
Is there gonna be a minority report?
Yes, Representative Hartnett is doing that.
Okay, thank you.
And the motion will be interim study.
Okay.
Okay, next up is HB 1773 FN, Representative Kesselring.
Yes, thank you, Mr. Chair. I'd like to introduce Amendment 1019H.
Oops.
And Representative Drew,
Second.
1019H. Okay, do you wish to speak to your motion?
Yes, Mr. Chair, thank you. This clarifies the language in the sodas and candy section that was in the original bill. It's a cleaned up definition, makes it a little bit easier to read and understand.
Okay. Any other discussion? Representative Nagel.
I just feel obligated to say this, but thank you for doing that. We were actually looking at strategies to control the consumption of these things. And this is really wonderful. You just saved me a lot of work.
Any other discussion? Seeing none? Okay, the motion is ought to pass on Amendment 1019H. Madam Clerk.
Representative Mazer,
Yes.
Representative Reinfurt,
Yes.
Representative DeLemus, yes. Representative Kofal.
Yes.
Representative Palazzo.
Yes.
Representative Drew.
Yes.
Representative Popovich,
Yes.
Representative McGrath.
Yes.
Representative Kesselring,
Yes.
Representative Lamontagne,
Yes.
Representative Lane,
Yes.
Representative Nagel.
Yes.
Representative Woods.
Yes.
Representative Palmer,
Yes.
Representative Tejas.
Yes.
Representative Hartnett,
Yes.
Representative Lucas.
Yes.
That's 18-0.
And
Oh, and, excuse me, Chairman McDonald.
yes.
Oh, my goodness, it's just a day
You've
for
been
me,
doing
right?
well.
I was doing okay until then. Well, sort of,
The motion passes 18-0 on the amendment?
yes.
Okay. And Representative Kesselring, do you have another motion?
Yes, I'd like to move ought to pass as amended.
And Representative Drew?
Second.
Representative Drew seconds. Do you wish to speak to your motion further, or?
I
to the
think we've
subject
heard
further?
enough. But
Okay. All right, thank you. Any other discussion? Representative Lamontagne?
Yes, well, I oppose this bill. I think, as a public health nutritionist, I certainly would like to see we as a people drink a lot less soda and eat a lot less candy. I don't think the approach of just limiting the purchasing power of one group of people is the way to do that. I also think this bill is really fiscally irresponsible. It's an enormous amount of money that we're going to spend trying to implement all these restrictions. The EBT vendors are opposed to it. There's going to be a lot of changes coming down as a result of the federal legislation that's passed. We don't need to muddle how we deal with that as a state by creating this other whole set of complicated requirements for the food stamp program. And some of the items in the bill are just so completely unachievable. Like we're going to have DHHS conduct an evaluation to determine the impact of this restriction on nutrition and health outcomes. Do we know how many factors go into the nutritional and health status of people? And we're somehow going to come up with a valid study of any kind with no money. So this is going to put a lot of burden on DHHS, which is already understaffed. And it's not going to affect how much money the state spends in SNAP benefits, because SNAP benefits themselves are already paid directly from the federal government. So I think it's a really bad bill, and I will.
Representative Nagel.
Thank you, Mr. Chair. I just wanted to point something out. It's on line, lucky number 13 on page 1. I'm not totally sure that that's necessary, and this adds an unknown cost to this bill. With that said, there's a lot of that already going on. For example, in our counties, most of our counties support the cooperative extension, and they do provide those services now, and maybe it would be better that we ramp up existing programs other than establishing new ones. There's a lot of other organizations such as the Federally Qualified Health Centers, Critical Access Hospitals, and places like that that already provide services like that. So I think it makes more sense to build on what we're doing than start a whole new thing. With that said, this is a huge issue. The most addictive substance in our society, with probably the largest health problem in our society, is actually sugar. And so I really appreciate the concept of trying to address this. I'm not sure what the right way to do it is, but I really appreciate the concept.
Other discussion? Representative Palmer and then Representative Lucas.
So this will be kicked. This bill, thank you, Mr. Chair. This bill, I got more mail from my own constituents and phone calls on this bill than I have on almost any other bill, which surprised me a little bit. And I'm not quite sure why, other than I think some of them thought it was just an attack on SNAP in general, rather than, the idea of getting rid of sugary drinks and things is great. But I also noticed that on the online testimony was 21 to 1 against, maybe with some of the same ideas. The main reason I'm going to vote against this bill is because it's just too expensive for what it does. And I think another approach would probably make more sense to try and get, as Representative Nagel talked about, to get to the same place.
Representative Lucas.
Thank you, Mr. Chair. I'll be voting against ought to pass as amended. I agree with everything that's been said in terms of making healthier diets available to everyone. But what I'm concerned about is that because of the cost of implementation, grocers who currently participate in SNAP, particularly small businesses, will choose to walk away from it, and that will just create more healthy food deserts than we already have. Thank you.
Thank you. Representative Hartnett.
Yeah, in addition to what's already been said in opposition to the bill, I'll oppose it because it will essentially drive up the cost of grocers. We heard from multiple people testifying that it'll just be a cost shift. Grocers will have some more work to do. They'll pass the cost of that work onto New Hampshire consumers. In addition, it'll hurt mom and pop New Hampshire-owned businesses. They'll be hurt by this, so I'll be voting against.
Thank you. Other discussion? Seeing no other discussion, a motion is ought to pass as amended on HB 1773 FM. Madam Clerk.
Representative Mazer,
Yes.
Representative Reinfurt,
Yes.
Representative Delamus, yes. Representative Copal.
Yes.
Representative Polozov,
Yes.
Representative Drew,
Yes.
Representative Popovich,
Yes.
Representative McGrath,
Yes.
Representative Kesselring,
Yes.
Representative Lamontagne,
No?
Representative Lane,
No.
Representative Nagel.
No.
Representative Woods.
No.
Representative Palmer.
No.
Representative Tejas.
No.
Representative Hartnett.
No.
Representative Lucas.
No.
And Representative McDonald.
Yes.
10 to 18. I mean, 10 to 8, sorry.
Okay, who is doing the minority, Representative Lamontagne?
Lamontagne.
And that is ITL, I assume? Okay. Okay, next up is HB 1790 FN. Representative Polozov, you have a motion?
Yeah, I move interim study on House Bill 1790 FN.
And I will second your motion. And do you wish to speak to it?
Yes, thank you, Mr. Chair. I believe that this bill requires additional studies. It addresses a real issue and offers a tried approach. Many states, both Republican and Democrat controlled, Florida, Massachusetts, use a similar model of involuntary commitment for individuals with severe substance use disorders who could be dangerous to themselves or others due to impairment. At the same time, this approach is not universally accepted and its benefits remain disputed. Moreover, there's some concern about including substance use disorder in the definition of mental illness and how it can affect other parts in our statutes. Personally, I would also would like to see a universal definition that would include both alcohol and other toxic and regulated substances, but the bill as written falls short of it, so I think we need to study it and include different subject matter experts to help us to come with better wording.
Thank you. Other discussion? Seeing no other discussion? Okay, the motion is for interim study on HB 1790 FN. Madam Clerk.
Representative Mazer.
Yes.
Representative Reinfurt.
Yes.
Representative Delamus, yes. Representative Copal.
Yes.
Representative Polozov.
Yes.
Representative Drew.
Yes.
Representative Popovich.
Yes.
Representative McGrath.
Yes.
Representative Kesselring.
Yes.
Representative Lamontagne.
Yes.
I'll go yes.
Okay. Representative Nagel. No, you're not. Representative Lane, sorry.
Yes.
Representative Nagel.
Yes.
Representative Woods.
Yeah.
Representative Palmer.
Yes.
Representative Tejas.
Yes.
Representative Hartnett.
Yes.
Representative Lucas.
Yes.
And Representative McDonald.
Yes.
Okay. It's 18 to 0 and the motion passes.
Is there any objection to consent? Okay. Moving on to HB 1794 FN. Representative Drew.
Oh, thank you, Mr. Chair. I'd like to move in expedient to legislate for HB 1794.
And
And I
Representative
would like to second.
Representative Polozov seconds. Do you wish to speak to your motion?
I think this bill is essentially unnecessary and interferes with messaging coming from the federal level about the changes that are happening with Medicaid.
Thank you. Any other discussion? Representative Lucas?
Thank you, Mr. Chair. I have to disagree with my colleague. I think this bill is very necessary. What we do know, and why we need this study, is that according to preliminary work done by Health Management Associates for AARP New Hampshire, Medicaid enrollment could drop by more than 10%, with 19,000 people losing coverage by 2030. The number of uninsured Granite Staters could grow 64%, leaving over 41,000 more people without coverage. What we don't know, and what we need to learn more about, is the amount of impact on state resources and infrastructure, on nonprofit health organizations, on folks with disabilities, on folks who do not make a livable wage and cannot afford private health insurance, on rural and underserved areas that already have healthcare deserts, on children and the elderly who rely on SNAP, on folks who rely on Medicaid-supported community health services to avoid nursing care, on folks who use Medicaid services for substance use disorder treatment and behavioral health support. Medicare should not be a line item. It should be a matter of survival. Thank you, Mr. Chair.
Thank you. Representative Nagel?
Thank you, Mr. Chair. Thanks for whatever. Still not used to this anymore. This is a huge issue. That could be devastating. The Congressional Budget Office estimates about 8 million people may become uninsured with the recent changes that have been made, and superficially that may not sound like a bad thing, but the problem is the ripple effect that creates. Those people are still going to get health care. It's going to be generally catastrophic health care, not routine health care. They're going to go to hospitals who have a responsibility to take care of them. It is estimated that 500 hospitals are at risk of closure because of these changes, which would be a devastating economic effect on basically every state in this country. We have already seen 2 primary care clinics that mostly cater to lower income people close. And that's probably just the beginning. So this could be like an economic problem. The thing that I really struggle with this bill was the fiscal note, and because I don't know that we have the money to pay that. With that said, half of it says comes from federal funds, the other half would come from state funds. I'm just doing some thinking, mind problem solving here, and I'm kind of wondering, is this an issue that would be amenable to the rural transformation funds? Not this year, but perhaps next year. I don't know. That's a question that's over my head, but you know, we are going to get at least 100 million next year. So that would be, you know, money that maybe we could use for something like this that would defray that cost. But I think it's a great idea to do this. How you pay for it's the issue. And I am going to support this.
Okay, Representative Palmer?
Thank you, Mr. Chair. I'm speaking as a board member for 2 small rural hospitals that are really struggling to keep up with what's going on. And what they really need is some clarity to be able to plan over the next 5 or 10 years. Where we keep making changes. The federal government makes changes, the state makes changes. Instead of being able to come up with a plan about how to staff primary care better, they're just figuring out how to keep the lights on. And so this isn't maybe going to cover all of the different issues, because there are other issues beyond Medicaid that are a problem. But right now, that's the one that's pushing the 2 small hospitals I'm involved with right to the edge. And so I'm really in favor of this bill. And we'll vote against ITL. Thanks.
Representative Woods?
Thank you. I think the intent of this is maybe I'm being overly reactive, long overdue. But having just said that, I think much of the machinery is already in place. And there's 3 of us sitting here who sit on the committee, basically, which is designated to do just this.
Talking about HHS oversight.
HHS, this is a nice description of that committee. So that is, in a sense, already legislatively in place. I think the question that sometimes that are specific, as was raised by Representative Palmer, can be raised instead of having a very broad term or project in place. Specific questions can be brought to that committee because that gets the question addressed in a more timely manner, number one. And number two, it may overlap with, I think as reference was made, to the Rural Transformation Project. Because that is fair, if those who are not familiar with it, is very expansive. And those of us on Oversight Committee hear just that. So my sense is that if we can just do diligence and pay attention at Health and Human Services Oversight Committee, and that's our responsibility, I would opt to do that, and I would vote for the ITL with that caveat that in fact that we do diligence. Thank you.
Thank you. Anyone else? Representative Nagel, did you?
I just wanted to add, I don't think we should underestimate the economic impact of hospitals on a community. And, you know, like for example, I live in the Lakes region, and the problem with Lakes Region General Hospital has been kind of devastating to the community. And, excuse me for discussing my hometown, but when Buffalo made a decision where they wanted to put the med school, they decided to put the med school and all the hospital complexes downtown. And that is the thing that's led to the economic recovery of downtown Buffalo. When you start to remove, and I'm pretty sure Concord Hospital is the largest employer in Concord region. And I can't speak for other places, but when you start to threaten their viability, you're affecting your ripple effect is huge. And I think it's really important that we understand what the effects of these policies are, how to plan for them going forward, and how to ensure that our hospitals stay viable. Otherwise, you know, this is a big problem.
Thank you, Representative Tejas.
Thanks, Mr. Chair. I want to add on to what's been said. I think it's irresponsible for us to not want to have the kind of information that this study will provide. We cannot make sound decisions without information, and to not be interested, to me, is dangerously irresponsible. I think all of us in this room and all our constituents are going to be impacted. The question is how much. You may think you are shielded from the impacts of this, but you are not. We're going to have rising health insurance prices. We're going to have facilities that go out of business, and you know, healthcare providers. Everybody is going to be experiencing these downshifted impacts and rising costs. And I think our constituents are looking to us to govern responsibly.
Thank you. Other discussion? Seeing no other discussion? Okay, I'll ask the clerk to call the roll. The motion is inexpedient to legislate on HB 1794 FN. Madam Clerk.
Representative Mazur.
Yes.
Representative Reinfurt.
Yes.
Representative Delamus, yes. Representative Kopal.
Yes.
Representative Polazov.
Yes.
Representative Drew.
Yes.
Representative Popovich.
Yes.
Representative McGrath.
Yes.
Representative Kesselring.
Yes.
Representative Lamonte.
No.
Representative Lane.
No.
Representative Nagel.
No.
Representative Woods.
Yes.
Representative Palmer.
No, but I hope Representative Woods is right.
Representative Tejas.
No.
Representative Hartnett.
No.
Representative Lucas.
No.
And Representative McDonald.
Yes.
Okay, so that is 11 to 7.
Okay, motion passes 11 to 7. And who's doing the minority report? Representative Lucas. Okay. And that will be to pass.
Mr. Chairman, I just want to run upstairs and get some copies of an amendment for the
Okay.
next bill.
Okay, so do you want us to take a brief recess or?
It's up to you. It shouldn't take more than 3 minutes.
Okay, well, why don't we'll be in recess for a few minutes. We have an amendment for the next bill that we need to pick up.
That's good. That's because I was prepared. If the clerk gets their crap together.
Killing it.
Okay, I'd like to call the committee back to order and take up the next bill, the last bill actually, HB 1797 FN, and recognize Representative Kofalt.
Thank you, Mr. Chair. So I move ought to pass on House Bill 1797 and move Amendment 1027H.
Okay, and Representative Polazov?
And I'm seconding.
Representative Polazov seconds, and do you wish to speak to your motion?
Yes. So briefly, what this amendment does is it retains most of the language of the original bill. There was a section at the beginning having to do with sodas and candy and making those ineligible for purchase via SNAP benefits. In order to sort of simplify things and give both the committee and the House an opportunity to vote on these as distinct issues, knowing that we just discussed a bill that addresses the soda and candy issue, this amendment would remove soda and candy exclusions from SNAP. So really all that's done is removing that provision, which was the first section. The other change is that there were, I believe, 2 references to the Department of Economic Security, that there is no such department as far as I am aware. That should have been the Department of Employment Security. So that typographical error has been corrected in this version.
Okay, thank you. Any other discussion? Seeing no other discussion, I'll ask the clerk to call the roll. The motion is ought to pass on Amendment 1027H to House Bill 1797 FN. Madam Clerk.
Representative Mazur,
Yes.
Representative Reinfurt,
Yes.
Representative Delamus, yes. Representative Kofalt,
Yes.
Representative Polozov,
Yes.
Representative Drew,
Yes.
Representative Popovich,
Yes.
Representative McGrath,
Yes.
Representative Kesselring,
Yes.
Representative Lamontagne,
Yes.
Representative Lane,
Yes.
Representative Nagel,
Yes.
Representative Woods,
Yeah.
Representative Palmer,
Yes.
Representative Tejas,
Yes.
Representative Hartnett, Representative Lucas,
Yes.
and Representative McDonald.
Yes.
Okay, that's 18-0, and that motion passes.
Okay, Representative Kofalt, you have another motion?
I do. I move ought to pass with amendment on House Bill 1797.
And I will second.
Representative Polazov seconds. Do you wish to speak any further to this issue? Or?
Yes, just briefly, this bill tightens eligibility verification. It ensures that we are not giving SNAP benefits to people with large amounts of assets, potentially millions of dollars in the bank. It also ensures that we are checking eligibility against the SAVE database, ensuring that that New Hampshire is compliant with federal requirements for SNAP benefits not going to illegal aliens, and it helps to reduce our error rate, which is critical for the funding, sort of not getting hit with a penalty by the federal government of anywhere between $8 and $15 million estimated. So I urge ought to pass with amendment.
Okay. Thank you. Representative Lamontagne.
Well, I am opposed to this legislation. I think it's unnecessary and interfering with federal changes that are coming to the SNAP program. And I also think it's incredibly expensive and wasteful. And so many of these changes regarding eligibility are making the department repeat some of their screening processes over and over again. Now it's saying that they can't, once they've certified someone to be eligible for TANF or Medicaid, they can't just accept, well, if they qualify that, then they're obviously eligible for SNAP, but they got to repeat the whole thing over again. And then, probably the worst of it, is almost every new requirement they have to do monthly. It's going to add so much more time to a department that is already understaffed and has a vacancy rate, and they're in a hiring freeze. I mean, this is incredibly fiscally irresponsible. And what is the end result going to be? It's just going to deny people who are eligible. Does anyone of us really think we have people with millions of dollars in the bank that are going to go through the trouble to get on SNAP for a benefit that's worth about $5 a day per person? So we're going to spend literally millions of dollars to do this. Just to keep people will end up not being eligible for SNAP who are eligible because of all the onerous paperwork requirements that we're putting on them. And then it's not going to make a difference in what the state actually pays in benefits. The state doesn't pay these benefits. The federal government is paying them. So we are going to have big cuts coming our way from the feds. We don't need to put an accelerator on that to kick people off. What we should be doing is preparing for how we're going to deal with all the New Hampshire citizens that are going to be losing benefits because of federal changes. And I had one more thought about that, but it'll come to me later.
Thank you. Representative Lucas.
Thank you, Mr. Chair. We heard in committee that HS has already made substantial progress in reducing the error rate, and they've almost reached, as of 2024, the cutoff. So I think that given their monitoring processes that are already in place, we ought to be able to give them a chance. They've already gone from 12, a little bit over 12% to a little bit over 7.5% in terms of error. And if that trend continues, they'll be way below the federal penalty line. And also, the department testified that they estimate that more than 8,000 adults and more than 6,000 kids will lose SNAP benefits completely if this law passes. For that reason, I'll be voting against to pass.
Thank you. Anyone else? Representative Woods.
Yes, I may have missed, but I didn't see a fiscal note either on the original bill or I didn't see was there one to come out with the amendment? Yes, okay.
Oh, yeah, that was a fiscal note.
Yeah, but yeah, well, there is, but it says indeterminate.
Oh, that's true. It does get into some description down below.
Some description, rather lengthy description, which would sort of support the argument Representative LaMontagne made about, you know, the multitude of levels and the cost associated with that, each one of those. And that's why I think, to me, I really would like to have had them give us a fiscal note so we could, in fact, have something that we could really tell the rest of the House about in terms of actual dollars. So I'm kind of dismayed, and as such, I'm gonna have to vote against it. Not because that's a really big item, and to vote for a big item but blindly, I can't do that.
Okay, thank you. Other discussion, Representative Nagel and then Representative LaMontagne.
Thank you, Mr. Chairman. I do want to thank the sponsor for bringing this up because it is a big issue. One thing I think that's important that we note is that when we look at this from a 30,000 foot view, when we look at dollars and cents, we kind of look at this as like a homogeneous population of people, and it's not. It's one of the reasons the Congressional Budget Office estimated that 8 million people would lose their insurance with the work requirement thing that was going to come down was because a lot of these people don't have the ability to do what this law requires, and they're going to risk coming off because they just can't do the paperwork, basically. As many of you know, I have an autistic son, and last I checked, I'm 66 years old, so I'll probably be dead in 20 years, and it occurred to me that right now I pay for all my kids' care because I can. So we started looking into the Medicaid process to get them on Medicaid for when I'm gone. And I remember when I talked to some of the leaders of Medicaid in this state, the first words out of their mouth was good luck. And it's hard. It's really hard. And last I checked, my mother said I'm really smart. So I think I might be, but I'm finding this to be incredibly challenging. And I can't imagine what it's like for people that are intellectually challenged and don't have community supports to do this kind of thing. And you're putting them at huge risk of coming off. So the next question I asked when we were in Washington, I asked the people that were responsible for developing that program, I said, well, what are you trying to accomplish here? And they said, we're trying to eliminate waste, fraud, and abuse. And I said, that's great. And I go, well, every system has some amount of waste, fraud, and abuse. What's your sweet spot? What are you trying to get? What's the cost benefit of what you're trying to achieve? And he had virtually no answer for that. And I really think that we're going too far, and we're going to be harming people. And when you go too far, you harm people that are at risk. And I think we seriously need to think about that, what we're doing here. And I am concerned that this, like that, all at one time is a perfect storm that I just don't think that we can afford right now. And I think it would be beneficial to wait and see where we get.
Representative Lamontagne.
Thank you, Mr. Chair. Yes, I just want to point out that in the last paragraph of the fiscal note, it does show, like when they put all that information together, it's well over $2 million in a couple of years. So I think if we're talking about eliminating waste, this is the opposite of that. This is the opposite of government efficiency. I mean, asking that they have to screen every applicant to whether on their immigration status monthly. I mean, people's immigration status does not change for years. They're stuck in an immigration system that's so backed up. But the food stamp program is essentially an anti-poverty program. It's not a nutrition program. It just gives people a chance to have enough to eat when they're struggling to pay all of their bills, period. And if there are ways we want to help lift people out of poverty, there are other things that we can be doing, that we should be doing as a society that would be so much more effective than just cutting off their benefits with no plan for how we're going to address the negative impacts of doing that. So I'm voting against the ought to pass.
Anyone else? Seeing no one else? Oh,
Just a quickie.
Okay, Representative Nagel.
I did ask them also when we were in Washington, what is your plan for dealing with the 8 million uninsured people that are going to result from this? And I got nothing, no answer at all. And that was troubling. And I want to reinforce what you said, because the people in Washington are saying they don't have a plan.
Okay, I'm seeing no one else. So the motion is ought to pass as amended on HB 1797 FN. Madam Clerk.
Representative Mazer,
Yes.
Representative Reinfurt,
Yes.
Representative DeLemus, yes. Representative Kofal.
Yes.
Representative Palazzo.
Yes.
Representative Drew,
Yes.
Representative Popovich,
Yes.
Representative McGrath,
Yes.
Representative Kesselring,
Yes.
Representative Lamontagne,
No.
Representative Lane,
No.
Representative Nagel. No. Representative Woods,
No.
Representative Palmer,
No.
Representative Tejas.
Nope.
Representative Hartnett, Representative Lucas.
No.
And Representative McDonald.
Yes.
10-8, motion passes.
And who's doing the minority? Representative Lamontagne. Okay. That'll be ITL. Okay, and that does it. That is all 14 bills we had on the schedule for executive session this morning.
Mr. Chair?
Yes, Representative
If I
Woods.
might, I would like to correct myself in the process of going through this real quickly. On 1335, I'm doing the minority report, and that'll, instead of ITL, it's going to be interim study.
Okay, so it'll be, the motion will be interim study for the minority report on
Correct.
1335.
Yeah, sorry, I just, too many of them lined up and.
That's, no, I understand. You were piling him up there for a while.
That's because he wasn't at the meeting.
Oh, yeah.
Anyone have anything before we adjourn? Just for the record, we have 5 Senate bills so far. We did have 6, one got vacated. SB 256, Commerce really wanted it, and I, being generous as I am, I said, you can have it. So we have 5 right now. One of them's an early bill, but that deadline isn't until April 16th, so I'm not sure when we'll meet, but it'll be, obviously be soon. Hopefully we don't get too many Senate bills. Anything else? Seeing nothing, we stand adjourned, and we'll be in touch.
So we can just email these to you?
Yes. I'm gonna try to wait till we get all the Senate bills, which should be soon. Well, probably after crossover, if I had to guess, because then we'd have to have them all. Oh, and I need all the committee reports before 1 o'clock, please, so.
Okay.
Thank you, Sherry.
Thank you.